I'm Dr. Jeremy, lead educator at the Electro Acupuncture Institute, and we help acupuncturists create breakthrough patient results using the world's most cutting-edge electroacupuncture techniques. What if your toughest cases aren't failing because of your protocol, but because one of 5 key organs is electrically undercharged? The liver, stomach, kidneys, lung, and heart on the ear holds the keys to most internal dysfunction. In this short training, I'll show you how to find them, scan them, and stimulate them so your treatments start holding and your outcomes improve fast. Before we dive in, grab the free download, the Big 5 Auricular Reflex Points for Internal Medicine Cases. The link is right below this video. Let's get started. All right, everybody, welcome to the Big 5 Internal Organs. And what you're going to want to do is you're going to want to diagnose first before looking on the ear for these organs. For example, if a patient comes in with, let's say, decreased kidney function, then you can start thinking that the kidney organ is decreased in voltage. It doesn't have enough energy to function. And we can insert energy into that kidney, for example, using the corresponding tissue on the ear. So first step is do your diagnosis. And then I like to use a point finder to confirm my diagnosis. So a patient comes in, they say, hey, can you help me with decreased kidney function? My kidneys are a bit slow. My kidney function's decreased. Maybe my GFR is decreased to 40. These patients, they come in with Western medicine diagnoses that we can use to know exactly which terrain, in this case, the terrain of the kidneys, that we want to improve. So what are you looking at here? You're looking at the layout, the general layout of the organs here, and I made a free resource for these Big 5 organs. Yes, you can absolutely go into the other organs, but these main 5 are great to start with. They're major organs that many of our patients have problems with. So again, patient comes in, you say, oh, their kidney is decreased in function. Let me take my point-o-select or point finder or even a pressure probe and look for the most tender or the most electrically conductive spot. In this case, you'd be looking over here at this kidney organ, which is right here. And you may wonder why it's in the mesoderm area, because there's a lot of mesoderm in the kidneys, right? Now, what is this showing? It's showing I take my point finder and I look on this outside flap here. If I don't find anything, I look underneath this flap here for the most conductive spot. If you're using a point-o-select, I like to say if it drops below 8, because the conductivity is from 0 to 16, anything that drops below an 8, I treat it. Now, how do you treat it? Well, you can mark it and stick a needle and then attach electricity to it. I like 10 hertz for this particular organ. Another option is you can apply, you find the point, you apply the 15 seconds of electricity with something like the point-o-select probe, then you mark it, and then you can place a tiny gold ear seed, which is like a trickle charge, which stays for like 24 to 48 hours. So 2 different methods of treating it. There are more, but those are main and effective ways. And the majority of the time when we're in clinic, we're using needles with electricity for 20 minutes. The 20 minutes will be sure to charge up that specific tissue or organ, but it will also, once you go 20 minutes, it will flip that organ into parasympathetic tone or parasympathetic dominance, so which generally increases the functioning of that organ. So first organ we're talking about is kidney, right there. Next organ is stomach. And you're like, well, which ear do you treat these organs on? Well, I like to give the example that the liver, we haven't gotten to the liver yet, but the liver is only on the right side of the body, so you want to treat the right ear liver. While the kidney, there's two kidneys, right? So you may want to check and treat bilateral. And the stomach, I always start on the left side. The stomach is on the left and the right side, but the majority of the stomach appears on the left ear. So you're looking at a right ear. Let me switch this to the left ear if I can. Yeah. So start there. If you don't find anything on the left side stomach ear, you can always try the right side. So patient comes in, they say, I have heartburn, or I have a emotional mental condition like anxiety, depression. Why? Because the stomach is responsible for breaking down proteins into amino acids, which become precursors to things like serotonin and GABA and happy things, even endorphins, for example, even dopamine, for example. So a patient comes in, they have known stomach organ issue, and you're like, okay, I think this patient needs, their stomach organ is deficient. So you come to the left ear and you search all around here. It's a large area, right? But wherever the pointo tells you or the pressure probe tells you, that's where today's treatment will be. So you find it, and wherever you find it corresponds to that location in the actual stomach organ. Okay. And I like to use 4.6 hertz here. That's an endoderm frequency. This entire concha floor is 4.6 hertz. But you can't go wrong by using 10 hertz, which is mesoderm. Isn't the stomach like a muscle? It's a lot of mesoderm. So 10 hertz works just fine. The next big organ is the lungs here. Now, both the right and the left lungs are on both ears. So I like to start with the dominant side, which is 90% of the time the right ear. So if you're on the right ear, they come in, they have lung organ issue. How do we know they have lung organ issue? Maybe they're a smoker, and that smoke is stealing chi every time they smoke and dumping a bunch of free radicals directly into that lung tissue. The blood flows through the lungs and circulates those free radicals to the rest. Maybe they have asthma, maybe they have COPD, maybe they have some sort of lung issue, chronic bronchitis, chronic cough, for example. Well, then your first part of your diagnosis is done. You're like, okay, I diagnose them with lung organ electrical deficiency or voltage deficiency. So then you come here and you're on the right ear, and look, the right lung is here and the left lung is here. So then you look with your pointo, for example, you find the most electrically conductive spot, and then you treat it. When I'm treating the lungs, if I find a spot here in the right lung, I would tend to look for another spot on the left lung. Also, we know we have different lobes of the lung, upper, middle, and lower. Wherever you find that spot using the electrical conductivity or your point probe is treating that particular lobe of the lung. Okay. Again, needles, electricity, 20 minutes is great. The next organ is the heart organ. And you're like, hey, Dr. J, I learned the heart organ here on the concha floor. Well, that is the endoderm of the heart organ, whereas I want you to find the mesoderm. The heart is a muscle, a beating muscle, right? So this is where the heart is found in this area here. Now the nerves from T4, T5 go down to the heart here. So this is where you would find a deficiency in the heart. Heart disease is the #1 killer in the world. So a lot of patients have heart disease. Even if it's not diagnosed, sometimes you can get great results by searching for and treating the heart here. Heart's a muscle. Every time it beats, it moves blood, but it also releases electricity into the pericardial sac, and then that pericardial sac feeds the electricity into the rest of the channels. So it's really the start of it there, the start of the channel system electrical flow. And then the last organ, let's see here, kidneys, stomach, lungs, that's 3, heart is 4. The last one's the liver, and this is a very special thing here. It's not as small as depicted here. When there's a electrical deficiency in the liver, and I did make an entire free content training on this liver. You may want to go back and watch that. But for now, when the liver gets deficient in electricity, it becomes the size that I'm circling here on the entire concha floor. So you would come here and you would search, and wherever you found an electrically conductive spot, you would treat that. And over 5 to 10 treatments, this electrical area will shrink, until it's down to only a specific spot, and then it will disappear altogether as the person's liver is getting all charged up and functioning properly, and the disease is going away. Now, what does the liver do? Well, don't only think of it as filtering blood, as producing bile, but a lot of the immune system is also related to the liver. It exists and lives in the reticuloendothelial system. So start thinking like allergies, autoimmune disease, things like that. You can get a really good outcome by treating this liver organ. So I wanted to keep it simple yet effective. There's 5 of the top organs. Maybe I'll make another one on the rest of the organs, but that's in the future. And if you look at something like the liver, look where the pancreas and the gallbladder is. If you're searching for the liver because of your initial diagnosis and you find something, you may end up treating a deficient pancreas or a deficient gallbladder. Same with the stomach. If you're looking for the stomach, you may end up treating a deficient small intestine. This is one of the reasons why I like to focus first on these top 5 organs. Now, if your cases aren't moving, scan these zones and check for electrical deficiency. One weak organ zone can block everything else from landing. Be sure to download your free guide below, print it if you want, use it in clinic, and if this was helpful, like, comment, and share it with a colleague. Want to go deeper? Visit electroacupunctureinstitute.com for full trainings and tools. See you next time.